Hello, once again, happy to be connected with you on this forum discussing hepatitis B and in particular in relationship to those who are proposing to get married or are already in relationship or living with their spouses. It is very common to be agitated when one of the partners has hepatitis B and the other one does not have. And so the question persists, and there remains uncertainty as to what to do about when you are intending to marry someone who is positive to a hepatitis B test and you are negative, or vice versa. This video intends to answer one, is it safe? Two, what should you do if you proceed? The first question I would answer, and the basis for which I will give that answer, I will explain. One, it is safe. Not safe in the sense that you cannot be exposed to the virus, but safe in the fact that, in the sense that there is also often a plan to ensure that the uninfected partner is not going to be infected. In other words, there are mechanisms in place to reduce the infectivity of someone so that you do not become a victim of hepatitis B as well. So how do we proceed here? The transmission of hepatitis B, as you're aware, has to do with sexual activity as well as other means such as blood transfusion of an infected blood or use of unsterile instruments, and or in certain circumstances from mother to child and so on. It is thus very important to recognize that you're going into a union that has to do with prevention. If your partner has a hepatitis B variant that has high infectivity, meaning that the viral load is high, or there is a particular protein elaborated by that virus and it has a tendency to be infective, then there is need for treatment. And once on treatment and the viral load is low, then there is no worries. The additional insurance that the partner should have who is negative should be that they should get vaccinated. And the negative partner has about a month course of vaccines which are very effective on the 0, 7 as well as 21. Oftentimes the 3 schedule will actually provide the needed insurance to develop immunity in such a way that even when they become exposed to the virus, they will not get infected. The other bit would be to ensure that the preventive mechanisms are in place, such as not sharing toothbrushes and or exposing themselves to blood spilled over or sharing sharps. The question as to whether there's going to be any particular long-term risk is that it remains on how you live with your partner and how you help each other. In general terms, with current knowledge, it is very, very certain that you will be well supported. The chance of progression of disease, in other words, if you're afraid that your partner might die earlier, is minimal, especially once you are aware of your status. Nowadays, many premarital counseling will ensure that you have tests for positive hepatitis B as well as other viruses. And that way you're able to know what you're going into and how you might be able to help yourself. So answering that question, it is safe for a positive hepatitis B patient to get married. I will encourage you to subscribe to this video and also come on to other videos and follow our series or like our video, and so that you can immediately access them when they come up. As to other videos explaining the consequences of a mother who is pregnant and who may have hepatitis B, there will be another video that will explain that for you, and it will soon be released, and once available, I believe you will be able to access them. Once you subscribe, you will be among the first to watch it, and it can help you to explain the scenario to many other people who are worried. The chance of progression of disease in hepatitis B is minimal. It progresses in some people, however, who do not care about doing what they should be doing. When vaccinated, there is about 97% chance of ensuring you don't get infected. And so there is no reason why a hepatitis B negative person should be worried about being in a relationship with one who has hepatitis B. It is not helpful to hide your status from your partner, because doing so means that you're exposing them to risks, besides exposing your unborn child to risks as well. So it would be advisable to let them know, such that they should do what is appropriate in order to stay safe. You would always need the negative person to care for you should you have any chance of decompensation. I hope this video helps you. Please don't forget to subscribe, and we'll see you soon in the next video. Thank you very much for watching, and please share the video and support those who are in need. Bye-bye.